Good morning, good afternoon, good evening to everybody who is joining us on this webinar today. It's fantastic to see you all. I appreciate that this is not what you were perhaps hoping for, that you wanted to meet us in person today, that you might be in London today, but I'm afraid the hot weather, the extreme weather warnings that we've had makes it not safe for us to have so many people on campus all at once. So thank you for bearing with us. We do have opportunities for you to visit the campus over the summer to have a tour. We do have an opportunity for an in-person open day in September as well, and we'll talk about that towards the end of the webinar. We also will be recording this webinar today, so we will make sure that it's on our website, on YouTube, as soon as possible, so that people who are unable to attend are able to listen to this and find out a little bit more about UCL. So a very warm welcome to you all. My name's Sarah Bennett. I am the admissions tutor for the medicine degree programme. I'm also one of the deputy programme leads, so I get involved in all aspects of the course. I was in fact a medical student at UCL myself, and so whilst it was a long time ago for me now, I do remember it really well. I obviously have a big fondness for UCL, having worked here as well. And so hopefully we can answer lots and lots of your questions that you will have today. I will go through the little outline. We're going to start off with a little quiz, followed by a presentation that I will do about the medical programme and about admissions. We will follow that at around 11 a.m. with a little break for a basic life support CPR session. So please have a teddy bear ready. You can resuscitate your teddy bear and learn a new skill whilst you're on the webinar today. And following that, we will have a Q&A live. So we've got some fantastic student ambassadors here and members of staff who are ready and waiting to answer your questions. Please use the Q&A function that's at the bottom of your screen. So if you click on that with the little question mark, it'll bring up a separate website that you can then put in a question. We will try and type answers to lots of questions as we go along. So hopefully your questions will be answered. But we will choose some of those questions to be answered live for everybody. So please don't hesitate to put something in there. I hope that a lot of the questions will be answered during the presentation. So you might want to wait a little bit until you've heard what we've got to say. So to start off with, we are going to look at some questions about UCL. So here we go. We would like you to go to something called Mentimeter. So you can do that on your web browser that you're in at the moment as a separate tab and go to menti.com and enter the code, or you can use a mobile phone or an iPad to use that QR code to get onto the questions. And we're going to be testing your knowledge a little bit here. So the first question is easy. Where are you at the moment? Where are you joining us from? Gosh, we've got 140 of you that are on there already. That's brilliant. It's so good to see so many of you. Are you in the UK? Are you joining us from a very hot UK? Although I think in some of the northern areas and Ireland and Wales are a little bit cooler than it is in London today. Or are you overseas? Are you joining us from elsewhere? Fantastic. We've got some people perhaps in Malaysia there, I can see, the Middle East, Europe, America. Gosh, in Europe, it's, I think, hotter than it is here. So I hope you are somewhere nice and cool. Lots of people in London, Northern Ireland, Scotland. Absolutely brilliant. So we've got people from all over the world. Fantastic. You're all incredibly welcome. So here we go. The questions. When did UCL first start training doctors? So many of you might have been on our website already and had a little look at this. Fantastic. Well done, everybody. Well done, the 118 that got it right. It was 1834. So all of those dates are quite auspicious to UCL. 1746 was when the Middlesex Hospital was built around nearby to UCL and started treating patients. So that was very early on in medicine as a potential career. 1826 was when UCL was built. It was the first university outside of Oxford and Cambridge, so the third university to be built in the UK. And it was very much built for the people that couldn't go to Oxford and Cambridge. The godless institution of Gower Street, as it was initially known as, because you had to be from a particular religion to actually go to Oxford and Cambridge at that time. But there was no hospital. The Middlesex Hospital wouldn't allow the students that were at UCL to train at the Middlesex Hospital. So UCL had to build a hospital. So UCLH was built. So the cruciform building, the big red brick building that's opposite the main gates at UCL, is the old UCLH Hospital, which is now a building that is owned by UCL and is lab space and the cruciform lecture theatres where our medical students spend a lot of their early years. So 1834 was the first time that UCL actually started training doctors. 1984 was when the Middlesex Hospital joined with UCL to become UCL Medical School. And 1998 was when the Royal Free Hospital School of Medicine joined us. So we are an amalgamation of those three medical schools. And so when I talk a little bit later about RUMS, our Medical Student Association, it's the Royal Free, University College and Middlesex School Student Association. Now, here we go. When did UCL first allow women to apply for courses? Amazing. Okay, so this is a difficult one, isn't it? Because actually, women in medicine hasn't been for a hugely long time. But we are very lucky that we had people, Elizabeth Garrett Anderson, and many other women at the time in the 1800s who really did want to take part as doctors and to treat women and children as well. And so 1878 was the first time that UCL first allowed women to apply for courses. And so it has been for a long time and quite amazing that it isn't only since 1878. Which of the following movies has been filmed at UCL? So UCL has quite a fantastic portico building. So if you do get the chance to come along and have a look at UCL, it is quite amazing to have a look at the front entrance. It has just been revamped for UCL 200. So we are disappointed to not be able to let you see all of the exhibitions for the UCL 200th anniversary, the bicentenary, but actually it's used quite a lot in movies. And so actually you are all correct. All four of those movies were filmed at UCL. So my challenge to you is if you can find somewhere cool to sit and watch a movie, watch some of these and try and look out for some of the parts that are filmed at UCL. And my last question to you. So how many clubs and societies are there at UCL? Well done, all of those of you that said over 400. There are over 400 different clubs and societies. The great thing about being a UCL medical student is you've also got RUMS clubs and societies as well as UCL clubs and societies. And so you've got so many different things to choose from things like club sports activities, all of the sports that you can possibly think of, cricket, football, various martial arts, to hockey, to swimming, to rowing, but also a lot of societies about cooking and special interests, the Harry Potter Society, the Beyonce Society, and so loads of things and something for everybody. And so do have a look at the Student Union website, because that's an important thing about coming to university, is being able to find a club and society that you feel part of and that you can have that time outside of the medicine course to do the things that interest you. Brilliant. Well done, everybody. We'll now move on to the presentation. So let me just share my screen that way for you. Here we go. Good. So hopefully you can all see my screen from here. So what is UCL Medical School all about? Well, we are training doctors. That's what we are doing. We're training doctors we hope will come and join us working in our fabulous National Health Service, which is free at the point of access. And we really cherish that within the UK. But we want to create on our programme highly capable physicians, those that are patient-centred, equipped to practice medicine in a professional, inclusive and sustainable way, grounded in best practice. So we recognise that medicine is for everybody. You are going to be treating people from every walk of life. And so we want you to appreciate what some of the challenges and differences might be in terms of treating patients from every different background. And the UK and London is an incredibly diverse place to come and work and visit. And we really make that part of our programme. And we, of course, want you to know that medicine changes. So what I learned at medical school nearly 30 years ago now is incredibly different to what our students are learning now. Techniques have changed, discovery has happened, and you can be part of that discovery as a medical student. In fact, 2 of our medical students were recently in the press because they discovered how midline diffuse glioma tumours spread in the body. And that was an entirely new finding that no one had ever discovered before. And they managed to publish a paper in Nature Journal. And our vision is underpinned by scholarship, rigour, professionalism. You're joining a profession. You are representing UCL, you're representing the medical profession when you are a medical student from day one. And we want students to be scientifically informed so that you can think about evidence-based practice. You'll be socially responsible and you can serve the needs of individuals and communities. So why do I think you should study at UCL Medical School? I'm obviously incredibly biased. I studied here myself and I work here now, but I do genuinely believe it's a fantastic place to come and study as a student and to study medicine. It's one of the best universities in the world. We've recently been ranked 8th in the world as a university. Medical school is 6th in the world in the recent rankings this year, which puts us top medical school in London. UCL is a multi-faculty institution, so that means that you will be around students from the arts, the humanities, the sciences. So you may well study with students with social science background. We've got the Slade School of Art, we've got languages. And I think that that's an incredibly rich environment for you to learn, to develop as a person, and to explore and experience so many other things. We've got a broad range of clubs and societies, as mentioned, so something for everybody. Our course structure is a 6-year programme. So that means we have a compulsory intercalated BSc that students all complete in year 3, unless you're a graduate. We're grounded in the applied clinical sciences in the early years. So we make sure that you are well equipped to then go on and think about how disease processes happen, and therefore, how do we treat them? It's incredibly important to understand how the body works and how it goes wrong before you start seeing patients in practice. We have a wide range of teaching methods across the course, and for our new curriculum that you will be experiencing in 2027, we are introducing a lot more interactive teaching methods and workshops and a lot more clinical exposure in the early years of the programme. And there's no doubt that UCL is a world-leading institution for research. And so you're going to be taught by those people who are researchers and clinician researchers. We'll be telling you about cutting-edge practice. There's not a day that goes by when you don't see somebody from UCL on the news. Hopefully, you'll be able to develop your research and leadership potential, because we want you to be the leaders of tomorrow, the change makers of tomorrow. We have an IBSc for that very purpose, so that you get some research experience that you can then take forwards further to perhaps our MB PhD program, if you'd like to spend 10 years with us at UCL, or to go on after you've graduated and to take that further with master's degrees and PhDs when you are a clinician and become a clinician scientist. We've got a range of vertical modules, clinical and professional practice. We really value you developing your professional identity whilst you're at medical school. And we really encourage you to represent your peers, to have your voice and your say within your program. We work together. You are our future colleagues. We want to hear from you. We want to make our program the best in the world. And you're going to experience some of the best teaching hospitals there are. So UCLH, the Royal Free, the Whittington, those are our main hospital sites, but you will also visit places like Great Ormond Street Hospital, the National Hospital for Neurology and Neurosurgery in Queen Square, Moorfields Eye Hospital, the Royal National Throat, Nose and Ear Hospital, and lots of community sites as well. And here, as I say, history happens. Our students who've just made that big discovery came from a big line of other huge discoveries. As I mentioned, UCL was the first university in London. UCLH was specifically built for teaching purposes. The first operation under anaesthetic carried out in 1846 at UCLH. That is a massive step forward in history. The London School of Women opened in 1874, and that then got amalgamated into the Royal Free Hospital. In 1864, the Epstein-Barr virus was discovered, and they were people that worked at UCL Medical School. So you could be the discovery of the future and have something named after you. There's still an awful lot more to discover about how the body works and how it doesn't. In 2010, we were the founding member of the Crick Institute, along with other institutions, so you may well experience some time there. And in 2020, more contemporary, we were well involved in the UCL Ventura mask that was used to treat breathing problems in COVID-19 patients. So there we go. Come and visit us and come and find out more about future discovery. So what is unique? Because we often get the question about what's different about UCL compared with other medical schools across the UK. And I will be the first to say that every medical school in the UK is absolutely brilliant. Whichever one you choose to go to, you need to choose the one that's right for you, where you feel you will thrive as a student, where you feel you will fit in, where you will enjoy the experience. You're going to be at university for many years, for 5 or 6 years. And so we want you to enjoy it. We want you to come out the other side as a very capable and competent individual, ready to thrive in the NHS. So for UCL, we are in central London. That's something to think about the size of the institution, to think about what hospitals you might therefore be training in. The academic focus of our course, we have the compulsory BSc, where there are only 6 or 7 courses across the UK that have that as a compulsory component. Many others, it is optional. There's a wide range of BScs. We have around 20 BScs that you can choose from, and we do have our own MB PhD program to take your research endeavour further. Our course structure is very much systems-based. So you can see from that diagram there, that's our new curriculum that you can have a look at on our website. We have just adjusted things in our new curriculum to make it run more smoothly across our programs, to add the clinical relevance, to make sure that the content is relevant to your future practice, and to streamline things as you go through the program. So the outcomes for graduates is still exactly the same. That's not going to change. We're all across the UK, as every medical school, creating future doctors. So we've got a curriculum to meet in the medical licensing assessment. However, how we get you there and the stepping stones to get there will be slightly different. And I do personally feel that our student community are everything to us. Our students are brilliant. They are the future. They are the people that will change medicine and healthcare going forwards. And we really value them working with us to create the best programme we have. So a little bit more about the programme. In the early years, we have systems-based approach. So year 1, blood infection immunity, cardiovascular and respiratory system, and the GI and renal system. In year 2, we do endocrine systems, the life cycle, the musculoskeletal system, and the nervous system. And across there, we have patient journeys that run throughout the course. And then we have the BSc. So let's find out more about the BSc. What is that? So you join the final year of a 3-year BSc program. We also have some bespoke intercalated BScs that are just 1-year programs. And here is the examples from this year. And so there is something for everybody. And what we hope is that at the end of that year, you will have done a research project, you will have learned about research discovery, evidence-based practice, and many transferable skills. So you'll see there's a student who's presenting a poster. So you get those skills that are massively relevant for your future career. Then the clinical years, year 4, 5, and 6, are spent in the clinical workplace. So you will be attached to a hospital for the whole year in year 4, one of University College Hospital, the Royal Free and the Whittington, and you will do basic clinical medicine so that you are then prepared to see a patient, to examine a patient, and to initiate investigations. Year 5 is our life cycle, where we do more of paediatrics and child health, women's health and specialty medicine. And year 6, you bring it all together. You go out into one of our district general hospitals outside of London, where you'll be much more one-to-one with foundation doctors to learn how to think and act like a doctor. And importantly, as I said, the vertical modules, these run throughout our programme. Their professionalism, their communication skills, cancer, equality, diversity and inclusivity, sustainability, ethics and law, personal development and medical education. So they're all the things that will make you a great doctor at the end of the course. How will you learn and where will you be taught? So year 1 and 2 is mostly in Bloomsbury. It's based around the Cruciform building and other small group work sites, but there is some off-site teaching at the Royal Free and the Whittington as well, where you will do the clinical and professional practice sessions. In year 4, 5 and 6, as mentioned, it's placement-based across London and the South East. And large lectures, small group tutorials where we have about 15 to 20 students with a particular tutor. There's self-paced learning where you look at online lectures and then come to our flipped classroom teaching afterwards. Self-study, practical skills teaching, and we do anatomy full body dissection in our well-catered laboratory at UCL. And at the end of each year, you have a summative progression assessment that includes an OSCE and an applied knowledge test. And across the year, you will complete a portfolio of activity. And so across the South East, you'll see there that Luton, Stevenage, Watford, Basildon, they're all sites that students will experience. We have over 200 general practice placements. So you can experience medicine in a variety of different settings, which is so important. Every clinical setting is slightly different, and it's really important that you experience that and have that knowledge and understanding. And so what to consider? Well, the size of the programme. We are a large course. We have 337 students in every year, which is over 2,000 medical students. Other courses are newer and smaller. Try and work out what's best for you. The support available, so we have our own student support and wellbeing service within our medical school, but also the services around UCL. What are the accommodation options that are available? Where are they? Some are in central London, some are a little bit further out. We have some fantastic new accommodation at UCL East in Stratford, so you can be around the Olympic 2012 site, which is brilliant. Or you can be in Canary Wharf in our new Urban East accommodation, which is also fantastic, brand new, and looks just like that picture in there. At the financial cost, that's got to be considered. Are there scholarships and bursaries that are suitable for you? And every medical school is entirely different. And clubs and societies, what are the opportunities? And will you enjoy it as a medical student? So hopefully I've convinced you that UCL is the place to come and visit, the place to come and study medicine. And we'd love to have you. But how do you get in? That's the next question, isn't it? So here we go. UCL Medical School admissions. So we have around 3,000 applications every year. So unfortunately, not everybody can be successful in achieving a place. We interview around 1,200, 1,300 applicants every year, and that's usually December to February. For home applicants, that's on site, in person. For overseas applicants, that will be online. And we have 337 places. Only 24 of those are available to international students. And we do have a contextual offer scheme. You don't need to know that you meet those criteria. We will identify that when you apply, and we will assess your application as such. And so you'll see there on the right-hand side of the screen that those are some of the criteria. Do have a look on the web to see if you meet those criteria, because you will be able to apply with lower grade predictions. So you need to apply to medical school by the 15th of October. That's for every medical school in the UK, and you need to apply via UCAS. All we look at when we receive your application are your GCSE English Language and Maths scores, your A-level predictions or equivalent, and we assess graduates and non-graduates equally. We do not look at personal statements. They can often be written by other people or perhaps by artificial intelligence, but it's a really good opportunity, I think, for you to write down why you want to study medicine and to really articulate that so that you're then prepared to come and talk about that at interview. We look at references for extenuating circumstances and contextual information, but it is not scored as part of our interview process. So the entry requirements for 2027 are GCSE grade 6 or a B in English Language and Maths. It's brilliant if you've got more GCSEs and you've scored 9s and 8s. That's fantastic. It'll stand you in really good stead for getting good A-levels and good A-level predictions. But we only assess that you meet the minimum requirement. We do allow students to resit GCSEs to achieve that minimum if they need to. Our standard offer, and therefore the grades that you need to be predicted, are an A star and 2 A's at A level, and you must be studying biology and chemistry, and one of those must be at A star. For IB, it's 39 points with 3 subjects at higher level, including chemistry and biology. And for our contextual offer, you're able to apply with grades of A, with the A's in biology and chemistry. All applicants will need to sit UCAT, the University Clinical Aptitude Test, in the year of application. So if you applied last year, you will need to take UCAT again this year. So it must be at this point. So the applications are actually now open, so you can apply and find a date. And graduates, you apply in the final year of your degree or beyond, and you will need to have achieved at least ABB at A level prior to your degree and a 2-1 in your degree. So there is no advantage in our process to achieving more. We don't score the number of GCSEs or the number of A levels. The offer we make will always be based on 3 A levels. And as I said, you can resit your GCSEs as well. So then in November, we receive your UCAT scores. So we receive those directly from UCAT, so you don't need to worry about sending them to us. And we rank students. So we rank based upon your total cognitive score out of 2,700. We rank our Access UCL, our contextual students, and international students separately. And you can see there's a link, a QR code that takes you to our selection procedure. So a little bit about UCAT. So we only used it for the first time in 2025. So we have very limited data to give applicants. And of course, for this academic year, one of the sections were removed, and therefore it is now out of 2,700 rather than 3,600. So we've posted the data on our website to show the minimum scores that achieved an interview, but with a big caveat that those minimum scores were for this academic year. It depends on who applies to us, how many people apply to us, and how many interviews we do in terms of what will be that lowest score. So it will change every year, but use it just purely as an indicator. The SJT part is only used to further rank candidates who have the same score. And I would always recommend that you look at the preparation resources that are on the UCAT website alone, okay? Here we are. These were the lowest scores this year that achieved an interview. So for our contextual candidates, it was 2,080. For home candidates, 2,190, and overseas, 2,300. So from December to February, we invite you to an interview. It's a multiple mini interview. So that means that there are multiple stations. Each one is 5 minutes in length with 1 minute of preparation time outside. And what we would like you to do is to have a conversation with the interviewer. Please don't over-prepare. Please don't rote learn answers. There's a lot of resources on the web to prepare for interviews. And so what we want to see is actually you and what you've done. What do you know about the career ahead of you? What preparation have you done for your application to medical school? Because that's what's most important, and that's what will get you an offer. So we have a look for values. We have a look for the values that are of the NHS or of UCL that are listed on this slide. And those are the sorts of things that we will talk about when you come to each of the stations. We then look at your total score for interview, and that is used alone to then make an offer. Now, the other question that we often get asked is about work experience. Now, there is no minimum requirement. There is also no requirement to have been in a clinical workplace. We absolutely understand how difficult it is to get clinical work experience in a hospital or a general practice. It's great if you can, but it's not required. There are many ways in which you can gain experience, and what's important is that you understand what it's like to work with other people and to care for other people. That's what we want to see. It's great to have an understanding of the medical profession and the values, and you can do that online. You can do that in terms of transferable skills through paid work, working in Tesco's on a Saturday morning, having to get up and show your commitment and perseverance and your customer service skills. They're all very relevant to applying to medical school and talking about at interview. There are Observe GP and on Brighton and Sussex Medical School website and a virtual work experience, which is also very helpful too. So have a look at the guidelines. Medical Schools Council is a fantastic resource for that. And so finally, studying medicine is difficult. It's challenging. It is competitive to get in, but it's absolutely brilliant. All of the clinicians that are on this call today will tell you that whilst in the press it might not seem that way, it is a fantastic career. It is an absolute privilege to be able to treat patients and to meet everybody and to be able to make a difference to people's lives. So go for it. If that's what you want to do and you see yourself doing that for the next 40 years of your life, please go for it. Do some research. It's really important that you make an educated application, that you know about the medical schools, you know what the course is like, and you know about studying medicine. So keep up to date as well. Read a little bit about healthcare on the news. Talk to your family about what's in the news every day. Challenge them to why is that an important thing. Review Medical Schools Council website. So I've put the two important websites on this slide here, Medical Schools Council and our prospectus, to get a bit more information. And reflect on what you already do. You already do amazing things. I'm continually impressed by sixth formers and how much they do alongside their academic studies. So use that as the transferable skills that you are developing. Please do the timed practice UCAT papers as well, because those preparation resources are really, really useful. It is competitive. It might take you 2 or 3 goes to get in, but don't give up. You can do it. We want you to do it. So wish you all the best. So thank you very much for listening to the presentation. I will stop sharing my screen at this point. It gives us an opportunity to review all of the questions that are in the Q&A. And whilst I bring on now one of our clinical skills tutor, Emma Tomset, is going to do a brief demonstration. So have your teddy bears at the ready for us to be able to revive them. Thank you, Emma.
Hello everyone, welcome to my little session. As Sarah said, my name's Emma. I'm one of the clinical skills lecturers based over at the Royal Free Hospital actually. In a past life I was a critical care nurse, so lots of clinical experience. Today we're going to have a go at reviving our teddy bears. So if you have got a teddy bear to hand, please join in. You could also use a pillow or a cushion. It's a bit strange, me just talking into the ether. I will break the skill down into steps. So just join in as much as you can. Okay, so the first thing that kicks off our little algorithm is checking for danger. And this is to check that we're not going to put ourselves in any immediate danger, and we're not going to put our patient into any immediate danger, and that it's safe to approach. So you would just scan around the area and check it's safe to approach. The next thing you need to do is check for a response in your patient. So we're going to talk to them initially because for all we know, they could just be very deeply asleep. So we would say something like, "Hello, are you okay there? Can you hear me?" If you don't get a response back, we're going to do a little bit more investigative work, and we're going to check the level of response in a little bit more detail. So we're going to get a little bit closer to our patient or our teddy bear, and we're going to shout into each ear in case they're hard of hearing in one side. And we are also going to gently squeeze their shoulders, and we're going to gently shake their chest as well. So hello, can you hear me? Hello, are you okay? If you get no response at that point, you have got an unresponsive patient in front of you. Now, regardless of how experienced you are, you can't deal with that on your own. So you need to shout and call for some help. And this initial call for help is just calling for local bystander help. So it's you just shouting loudly. If you're out and about in the public area, you hope that a member of the public is going to stop and help you. If you're in hospital or a clinical setting, you would just shout and hope that your staff, your colleagues would come and give you a hand. So you just shout and say, "Can I have some help here, please? Can anyone help me?" The next step is to assess for signs of life. And we break this down into airway, breathing, and circulation. So to assess our patient's airway, the first thing we need to do is actually have a look inside their mouth. So we gently open their mouth and we check to see if there's any physical obstruction, something blocking the airway. So we have a little look, there's nothing there. The next thing we need to do is we need to open that airway back up, because what has probably happened is the tongue has relaxed and has fallen back and is now occluding the airway. So what we do is a very simple airway maneuver called a head tilt chin lift. So you put your one hand on your patient's forehead, your other hand, your fingers you just place under their chin, and you gently tilt their head and neck back. And we describe it as they're sniffing the morning air, which is a bit strange. But that simple movement will move the tongue out of the way and will open the airway back up. So once we've sorted the airway out, we now need to assess breathing and circulation. So the B and the C parts. To assess breathing, we need to get a bit closer to our patient again. So we're going to come down to our patient's head and we're going to be feeling for their breath against our cheek. We're going to be looking down their chest to see if we can see their chest rise and fall. We're listening for any breathing sounds. And at the same time, we're feeling for a pulse in the neck, and that's called a carotid pulse. So we're going to place our two fingers on their neck and we're going to assess for a pulse. And so we assess for breathing and circulation together, and we do it for no more than 10 seconds. As humans, we're all quite hopeful. So it's 10 seconds for a reason, because otherwise we think it's okay, they'll breathe in a second. But 10 seconds is that cutoff point. We get to 10 seconds. If there are no signs of life, unfortunately, our patient is in cardiac arrest. So we need to progress now and call for some expert help, and also start CPR. So that call for expert help is really important, because if we don't call for expert help, no one's going to come and help us and we'll be on our own for a long time. So if you're out of hospital, that's your 999 to the emergency services. If you're in hospital, it's a special number that you'll become very familiar with, and that's a 2222 call. So you're calling for some more expert help to come to your bed space to help you out. Whilst that's all going on, you can start doing some chest compressions. Okay, so this is where you might get quite hot doing this, especially because it's quite a hot day. What you need to do is you need to interlace your fingers, you need to lock your arms into a nice straight position. And then you're going to use the heel of your hand, and you're going to place the heel of the hand at sort of the base of the sternum, nipple-ish height on the chest. The heel of the hand is what maintains contact, and you're going to push down onto that patient's chest. We push down about 5 to 6 centimeters, and it's quite fast. We have to go at a rate of 100 to 120 beats per minute. So you're basically acting as that person's heart, because we're trying to pump and oxygenate and keep that blood pumping around the body. I realised recently I need to update my musical references, because younger generations no longer know who the Bee Gees are, because we used to teach that you could keep in time by singing Staying Alive in your head, which is a Bee Gees song, but not many people know who that is anymore. So some more modern references are Baby Shark or Carly Rae Jepsen, Call Me Maybe. So if that helps, you can sing that along in your head, but we need to keep a rate of 100 to 120 beats per minute, and we're going to do 30 compressions. We're going to press down 30 times, okay? So I'm going to do 30 now for you. So here we go. Please join in at home on your teddies or your pillows. Okay, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 12, 13, 14, 18, 19, 20, 30. Okay, so we've done our 30 chest compressions. Once we've done our 30 chest compressions, we need to give 2 rescue breaths. Now I do have a bit of equipment with me, which I brought home from work yesterday. This is a bag valve mask. It's a pediatric size, so it works quite well with my teddy bear. The adult ones are obviously a bit bigger. You'll learn all about this. It's actually a 2-person technique, but because it's just on a teddy bear and this is all quite small, I can do it by myself. So we place the mask over our patient's nose and mouth. We maintain that head tilt chin lift, that airway maneuver, and then with our other hand, we squeeze the bag to deliver 2 breaths. Now, if you're out of hospital and you don't have this fancy equipment available to you, you can do rescue breaths via mouth to mouth. So you can pinch your patient's nose together, and then you can give them your expired oxygen by creating a seal over their mouth. Now, we appreciate that's not all people will want to give mouth to mouth. So if you don't want to do that to someone you don't know, the guidelines say that's actually okay, and you can just do continuous chest compressions. But once you get to this stage, you just keep going. So once you've given your 2 rescue breaths, you then get straight back onto that patient's chest and you deliver another 30 chest compressions. And you keep going until that more expert help arrives. Hopefully with another additional piece of fancy equipment, which you may have heard of or seen in public spaces now. It's called an AED, an automatic external defibrillator. You see them a lot in train stations, big shopping centres. A lot of old public telephone boxes have now been repurposed and house them. And actually, if you call 999, the dispatcher will tell you where the nearest one is. So you could send off another member of the public to run to find that AED. So you can bring that back, and then you can put your special pads onto your patient's chest and follow the instructions on the AED and deliver what we call a little shock to the patient to see if that will help restart their heart. But it's hard work. It's those compressions, those rescue breaths, that ratio of 30 to 2, and you keep going until that expert help arrives, until you've done such an amazing job that your patient starts to show signs of life again, or if you become so exhausted and tired, you can't carry on and someone else will take over from you. But hopefully you'll do such a good job that you'll revive your patient / teddy bear, and then the paramedics or the more expert help will take over and make sure that they're okay. So that was very much a whistle-stop tour of basic life support. But yeah, one of the skills that you will get taught in first year, actually, if you do come to UCL Medical School. But yeah, I look forward to possibly seeing some of you in the not too distant future. Thank you very much.
Thank you so much, Emma. So hopefully all of you have revived your teddy bear.
Yes,
I went to hunt out my teddy bear. It's a fantastic skill to learn, and we teach you that skill right from year 1 of the medicine program. And then every couple of years, you get a refresher of that. And that will be the same throughout your career, that you need to keep your skills up to date and to make sure that you're able to do that, because you never know when someone might collapse in front of you in the street, or on the underground, and that you might have to do that. You might have to help somebody, and it's one of the most rewarding things to bring somebody back to life if you can. So thank you so much, Emma.
No
Well
worries.
done, Teddy. Brilliant. Right. So thank you so much for all of your questions so far. We've answered 101 in the chat. So thank you, team, for all of the typing. I'm going to come to my panel now. So I shall welcome the panel and ask them to introduce themselves to you, tell you who they are, which year they're in, because we've got a couple of newly qualified doctors on our panel here. And please, can you tell the audience why you chose to study at UCL? Charlotte, do you want to go first?
Hi everyone, I'm Charlotte. I've just finished third year actually. I was intercalating in pediatrics and child health, which was a fantastic year, would highly recommend. Um, the reason why I chose to study at UCL, it's quite a couple reasons. One of my main ones was, to be honest, when I came to the open day for UCL, so let's be like this, but in person, I guess. I spoke to some of the students and I just kind of saw myself sort of fitting in there. And it's kind of one of those things that you can't really like put your finger on, but um, they just seem like such friendly, sociable people, the kind of people that I would want to surround myself with. And then have like be on campus, there's a real feel to it. So definitely come see campus if you get the chance to over summer or in September, because it'll definitely give you a better feel for what UCL is quite like. I also just love the location of UCL. I think it's right in the center of London, and you're so close to everything that you want to be close to. You can be a tourist, you can go visit all of the London things, or you can just sort of go shopping in Oxford Street, like a couple minutes walk down the road. So there's lots of things, but I think those are my main ones. Thanks.
Thanks, Charlotte. Absolutely. I mean, we have students from in London who stay and commute from home, and we have lots of students from outside London too. I was from outside London. I came from the northwest, where it's a bit cooler today, and it did feel like a big thing coming to a big city, but it was so exciting to do that. And London is a great place to be a medical student. And we've just put in the chat the link to the September open day that we're holding that's specifically for medicine. So you'll get to come and meet us, probably the same people, I would imagine, and perhaps come to a taster session and to meet our medical students, talk to people about the programme, have a campus tour. You're all very, very welcome for that. Brilliant. What you forgot to say, Charlotte, is you are the RUMS president for the year ahead. So you will see a lot of Charlotte if you come to UCL from 2027 onwards. Brilliant. Joel, do you want to go next?
So, hello, I'm Joel, and actually both Lauren and I have finished final year now. So the reason that I chose UCL, I think was actually very similar to Charlotte. It was really only coming there, experiencing it, the atmosphere of the place, talking to the students and thinking that actually this is the kind of place for me. And a lot of that actually is the course as well, the fact that you're building your knowledge around the different specialties, the research that you get to do in the IBSc, and then you're really delving into the clinical years in some of the best hospitals in London. So yeah, I've just really enjoyed my time overall. Yeah,
Brilliant. Thank you, Joel. Congratulations, and you're going to be a great doctor, UCL doctor ahead forever. Brilliant. Josh, you're next.
Hello, everyone. I'm a second year medical student going into my third year, integrating in anatomy and cell developmental biology. I would say that when I was applying to medical school, one of the big things I was interested in was sort of doing getting into research. I had no clue what that meant at the time, but I just knew that I wanted to do something like that. And first off, UCL is obviously a leading institution, so that was the main thing that got me interested in the first place. But I would say the combination of that and the fact that we're partnered with so many great hospitals, and we're so close to so many great research institutes, such as the Francis Crick Institute, massively famous, and hospitals such as Great Ormond Street. They're so close to us, and you get so many opportunities to actually go out and talk to these professors and doctors, and end up working with them with research projects. And I think it's really inspiring how sometimes you can actually get involved with some of the work that your lecturers are doing if you reach out to them. And everyone at UCL, the students and all the doctors and teachers, they're so talented. And it's awesome being surrounded by so many talented people and being able to work with them. So I'd say that's one of the main reasons that got me interested.
Brilliant. Thanks, Josh. And Lauren.
Hi, everyone. I'm Lauren. As Joel said, I'm also in final year. I think for me, the main reason I wanted to go to UCL was the full body dissection. Thought that was a really cool opportunity that's quite unique to UCL. Such a privilege to have access to someone's body that they've very kindly given to medical students. So that was a massive driving force for my application. And then also the opportunity to do an intercalated Bachelor of Science degree. So I did anthropology for my degree and absolutely loved it. It's literally like the highlight of my time at medical school. And I thought it was just a really good opportunity to try something new and get some research exposure. So that was my two main reasons.
Fabulous. Thank you very much. So that's our wonderful student panel. I'm going to come to Dr. Lal. You didn't study at UCL, I'm afraid, but is one of our deputy programme leads alongside me. And I've got a question for you. It's about research. So there are lots of questions about how to get involved in research as a medical student. Can you talk a little bit about how that's possible?
Okay, of course I can. So there are lots of opportunities to get involved in research, but I think it's important to remember that your main reason for coming to the medical school is to pass your MBBS. So it's really important not to push for research at the expense of not doing quite so well in the MBBS. It's a tough course. So there are main opportunities to get involved in research are in the BSc. So all of you will be doing a BSc unless you've already done one. And that's a great opportunity to spend a year in some type of research. And you may well get involved in projects that spin off from that you'll be able to continue through the next 3 years. We also do an MB PhD. So that's usually taken after your first year 4, first of your clinical type years. And then you can spend a little bit longer, it's usually 2 years, to get a PhD. And that's for people who are really quite set on or sure that they want to follow a really highly academic research-led career. But there are also opportunities to get involved in some research with people who are working within the wider UCL and in clinical research by some of our world-leading clinical researchers and academic clinicians in some of our big central hospitals. So there are plenty of opportunities to do it, and I'm sure that the students who are on the call here have done some to some degree. But I think they probably also would say that you need to be a bit careful because you don't want to do the research and end up with a publication but no MBBS because you spent too long doing the research.
Brilliant. Thank you very much. And you did your PhD after becoming
I did my PhD. Yeah, I qualified and did about 3 or 4 years within clinical medicine before doing my BSc at UCL. In the end, in fact, I took 2 years out and did it there. 3 years.
And I'm doing my PhD now, which is taking me a rather long time. But there are plenty of opportunities to do research once you've qualified as well. And a lot of doctors do PhDs later on in their careers when they've got a good sense of what specialty they want to go into and what their research interest in that specialty might be. But there is no requirement for you to do that at all. So there are still lots of doctors out there that don't take a research focus and are very focused on their clinical career too. So that's the great thing about medicine, is that once you've qualified, you've got so many routes in which you can go, because you can take an education route like I have, you can take a research route, you can take a clinical scientist route, you can take a cancer-based route where you become a lead for something, a particular service within your particular specialty area, or you can work for NHS England and try and decide what it is that we do as an NHS as well. So you can be the leaders of tomorrow. Fantastic. Thank you. So I would like to ask Charlotte a question, please. It's a little bit more about RUMS. So could you just talk a little bit about what RUMS is and what do you do to support students on the course?
Yeah, sure. So, as previously mentioned, RUMS stands for, it's quite a mouthful, Royal Free University College and Middlesex Medical Students Association. Don't worry, we're not going to quiz you on that one. But what it essentially is the medical student body at UCL. So if you decide to join us here at UCL Medical School, you'll automatically have a RUMS membership. And essentially RUMS looks after like lots of aspects of your medical school life. So from your academics. So for example, RUMS like works very closely with the medical school to sort of shape the curriculum. My role this year was working as academic VP, which is what Joshua will be next year. They're very receptive to student feedback, and what we say is really important in terms of them improving the course. So that's quite a massive part of RUMS. Another big part is our RUMS welfare. So I think one of the most fantastic things about RUMS and UCL Medical School is this like student community that we have. We look after each other really well. If you decide to join us, you'll be put into a RUMS family. So you might have students in year 2 that will be assigned as your RUMS mum or your RUMS dad. You might even be looking at some grandparents, which are year 3s as well. We run lots of events with these families, and there's lots of like welfare events as well. Another kind of big aspect, of course, is the RUMS events. So you might be looking forward to your freshers, which is sort of the first week when everyone begins uni, and it's a very chaotic week to say the least, but lots of fun. And RUMS basically does a dedicated freshers fortnight. So there'll be lots of events running throughout the first 2 weeks of you starting uni, such as a boat ball, where you'll, dress up, go on the Thames, in black tie. You get to meet a lot of your year. It's really fun. There's a scrubs party, which is really cute. So it's basically the first time you're going to wear scrubs ever, and it's not going to be in a hospital. It's going to be in our basement bar. And it's such a fun party. You just get to meet your entire year and just party. It's really good fun. So there's lots of things to get involved with there. And another one of the big things of RUMS is our dedicated sports teams. So as Dr. Bennett mentioned earlier, you have your RUMS sports teams and you have your UCL sports teams. RUMS sports teams are sort of dedicated to the medical school timetable. So your training, your games, your fixtures, they all fit around quite a busy timetable. Since our timetable will tend to be a bit busier than the average UCL student. So there's lots of sports you can get involved with there. There's RUMS tennis, badminton, rugby, football, hockey, boat club, cricket, netball, a couple others. So whether you played that sport in school or you want to try something new, RUMS sports are just so welcoming, and it's a massive part of sort of my medical school experience. If you're not into sports, that's okay too. RUMS does like music as well, and there's a comedy review. There's something for everybody, and I just think RUMS is just such a unique like community. It's not like school when you're like so separate within different years. I think it's such a lovely thing to make friends across all years, and support each other. So yeah, it's become such a massive part of my life. Of course, I'm going to be the president next year, which is very exciting. But yeah, hopefully if you decide to join us in a couple of years' time, it'll be the same for you too.
Fabulous. Thank you, Charlotte. And I think that's such a huge part of UCL is the support and collegiality that we have within our student body, is that we want 337 to come in and 337 to go out the other end as UCL doctors. And I think our student body really does work to support and help each other through the course. So we try and promote a non-competitive atmosphere once you come to UCL. That's really, really important. Brilliant. I've noticed that there are lots of questions about deferred entry that have come through, so I will answer this one live. Just to reassure you, we encourage deferred entry. It's great if you want to take a gap year. Some students need to take deferred entry because they're doing military service within their country. You can apply for one deferred year when you apply through UCAS. So we ask of you that you do apply for deferred entry so that we then know that that's what you would like. We assess your applications absolutely equally. So when I choose people to come to interview, I don't know whether they're deferred entry or not. So that makes no difference at all. And deferred entry can be quite good for people to earn some money, to gain some other life experiences, to have opportunities to go and work and to go abroad or to work with charities, etc. So it can be a fantastic thing. All I ask is that you do apply for deferred entry and that you don't wait until after an offer has been made. That's because we have a fixed number in medicine, and we want to be able to fill all of our places. And if we've made you an offer and then you defer your entry, it affects our numbers. And so we might not be able to allow you to defer your entry at that stage if you don't ask us beforehand. So I hope that that's cleared up. We do want you to do it. It's not a disadvantage, but please do apply for it before you're made an offer. Okay, I'm going to come to Lauren if that's possible. Can you work outside your studies? Because I know you've been part of the Target Medicine programme, so you've been doing some work for us. Can you tell us a little bit more about the opportunities to work?
Yeah, definitely. So you for sure can work outside your studies. I think for a lot of people it's necessary. Obviously, studying in London can be very expensive. And so a lot of students at some point will have to have a job alongside the degree. Obviously, you've got to be able to balance the demands of the degree with that job. So you've got to be mindful of not like working too much outside of the medical degree because it might not be sustainable. But I think that within UCL, there's lots of opportunities to work. So, for example, I work in Target Medicine, which is like a widening participation group, where we work with students from disadvantaged backgrounds and help them with medical school applications. And as part of this, I help with open days and things like this event today, which is paid. And that's a really good opportunity to work quite flexibly and do things that, work every now and then in a way that's quite sustainable throughout your time at medical school. I also do tutoring and have done throughout my time at medical school. I've worked for several charities and worked in hospitality as well. So you definitely can have a job. A lot of my friends also work within the UCL campus. So some people work at student bars, for example, or cafes. And all of these job opportunities are advertised on the Student Union website. So you can constantly check if there are jobs available on campus. And I think it's a really good way to meet people as well, especially people from outside your course having a job. It teaches you a lot of skills that are very relevant to the medical degree. And if you find that you can't juggle the job alongside your medical studies and you're struggling financially, there's a lot of financial support as well, and bursaries and things like that. So you shouldn't ever be worried about finances. There's a lot of support available.
Fabulous. Thank you so much, Lauren. And absolutely that. We have a UCL job shop where there are lots of opportunities to work on campus or around campus and lots of opportunities for medical students to get involved. And a lot of students do work these days. We recognise that the financial situation in the UK is difficult, that it's expensive to come to university, but it is possible. It becomes slightly less possible in clinical years. So in the clinical years of the course, you are here for 39 weeks of the year. Sorry, not 39 weeks, for over 49 weeks of the year. So you only get a small amount of holiday in which to work. So it is definitely worthwhile planning your finances as you come through university in general, and particularly at medical school when it is such a long course. Great. I'm going to come to Josh, if that's okay, for a question about clinical in the early years. Can you tell us a little bit more about what sort of clinical things you've done in the early years of the course?
Yeah, sure. So obviously in your first 2 years, the preclinical teaching, so it's mostly lectures, but we do have weekly CPP teaching, clinical and professional practice, they call it. And essentially you're at one of the partnered hospitals at UCL, for example, the Royal Free, Bloomsbury, UCLH. or the Whittington. And essentially at these teaching sessions, you're in smaller groups compared to lectures where you get more clinical teaching. For example, that could be like learning BLS, like we just did with the teddy bears. Um, so it's a good mix. They still get you to do a lot of clinical stuff in the early years, so it doesn't feel like you're just learning like science. Um, I'd say it's a good way of integrating it and slowly introducing patient contact, because we also do that as well. We meet like a number of visitors who volunteer to come see us. For example, this could be patients with certain genetic conditions, or uh, looking at the work of doctors and stuff when we go to the hospitals. So there is lots of clinical stuff mixed in, which is really great, because sometimes, because it's a theory-based first 2 years, it can feel like a lot of science, which I think is a good thing to prepare you for the clinical world. But there is lots of stuff still mixed in, so it's a good balance, I'd say.
Thanks, Josh. Yes, and so in the new curriculum, we are hoping to just expand a little bit more of the clinical placement time in the early years, a lot more patient contact. As I mentioned in the presentation, it's really important that you've got the basic medical sciences, the applied clinical sciences in the early years. So we do focus on that, but we look at how that science fits with clinical practice. And so you will then see how that plays out in disease as well as in health, and you will see patients and learn those basic skills so that you're ready to go into clinical practice in year 4. Dr. Lal, can I come to you a little bit? What can you talk to us a little bit more about the new curriculum, what the changes will be in 2027?
Well, I don't know how many people are familiar with the current one, so it's difficult to talk about the changes, but just to give a broad outline of the way that things will work. So in the first 2 years, as Dr. Bennett's already said, it's predominantly the sciences, but with an increased amount of some clinical contact. So some patients will be coming in, and there will be some short placements where students get the opportunity to go out into general practice to talk to patients and get a feel for what being in a clinical scenario is like. And each of the first 2 years is split into 3 separate modules. In year 1, you have blood, immunity, infection, cardiovascular, respiratory, and then gastrointestinal, renal. And in year 2, it's endocrine, musculoskeletal system, and the nervous system. There will be the opportunity to do some study of something you find more interesting, particularly interesting, just at the end of that each of those years, which we call student selected components. And then we're also introducing something called patient journeys. And that's again to increase the amount of clinical that you have. So you'll be able to have some clinical exposure to patients who are relevant to the particular module that you're studying at that particular time. So you get 3 little ones during each of those years. And running throughout the first 2 years and the rest of the course are what we call the UCL Future Doctor, which is all around professionalism, leadership, and patient safety, planetary health and sustainability, one bit, and then the other bit, some sciences which underpin everything. So that's things like anatomy, imaging, cancer, embryology, genetics, pathological sciences, and they run throughout the course. Concentration of those science ones in the first 2 years, and then less so in the clinical years, but making sure that they're still very relevant. Now in year 4, 5, and 6, it's predominantly clinical placements where you go to the hospitals. In year 4, it's the big central hospitals, UCL, the Whittington, and the Royal Free. In year 5, again similar, but going out to some of the associated hospitals to do with pediatrics, obstetrics and gynecology, neurology. And then in year 6, you go to what we call the district general hospitals, which are a little bit further away from the centre of London and from UCL, but still very close to 6 district general hospitals that we have very, very close working with. And that's where we ask you to integrate all of the science, all of what you've learned around the basic medicine in year 4, all that you've learned about life cycle in year 5, and integrate that and do what we call an assistantship. First one is within the hospital. emergency care, medicine, surgery, and the second one being out in the general practice. And we asked people then to be an assistant, which is almost acting like a doctor, but not quite, because you're not quite a doctor. And that helps you get yourself absolutely ready for the final MLA examination, which is usually taken in February. And then you've got a lovely period after that where you have 8 weeks abroad doing an elective and a 4-week period, which we call preparation for practice, where we make sure that we polish everything off so that you'll be brilliant F1 doctors.
Superb. Thank you very much, Dr. Lau, for explaining that. Joel, may I come to you? Can you talk a little bit about the preparation that you did for your application and what you would advise students to do?
Okay, sure. So a lot of people worry about having direct clinical experience. And of course, that does help because you get a sense of what's going on in that environment. But it's really anything where you're working with other people, interacting, using communication or teaching skills, where you can reflect on those experiences. So all I'd really advise is that whatever you're doing at the moment or have done, keep a record of it at the end of each day once you've finished that thing, and just reflect on what have you learned from that kind of experience. And that's really what they're interested in. So it doesn't always matter if you've gone and done some work in a hospital or a GP setting. A lot of the things that I spoke about were teaching younger students or going into primary schools and stuff, because I was able to do that. And all of that was just really about building those communication skills, I think. And that's what matters the most.
Brilliant. Thank you, Joel. I wondered if I could ask Charlotte the same question. What preparation did you do for your application? What would you advise students to do?
Quite similar to Joel, I didn't have very much clinical work experience, especially when I was applying. It was like around the COVID time. It was quite difficult to get experience like in a hospital necessarily, but I did quite a bit of stuff like sort of volunteering in a charity shop. I did lots of tutoring. All of these things produce really like good transferable skills, which you can talk about in your interviews. And it's really important to bring these experiences up because even if they seem really small and insignificant, it's more about how you reflect on them and what sort of like skills and qualities that you've learned from them that would eventually make you a good medical student and doctor that UCL really cares about. In terms of other preparation, I think sort of thinking towards about interviews and things like that, it's quite important. I think UCL interviews are like they're a very good filter in terms of they really select people who are very people, and are sort of very able to talk about your experiences and reflect on those things. So when you're practicing for your interviews, I would highly recommend, like, this is what I did. I literally just put my phone in front of me and I recorded myself speaking and answering questions that I think might come up. And that was really useful because it means you can watch those videos back and say, like, you can look at where you can improve. You can just practice speaking, because I think writing down answers is pretty good, but actually saying them out loud is a completely different thing. So I think those were kind of my big tips in terms of applying for UCL. Yeah.
Great. That's really helpful to have those two perspectives there. So I just want to reiterate about the process itself, because I see a few questions of confusion over the application process. So our selection procedure is a bit like hurdles. So the first hurdle is when you apply, we look at you meeting our minimum academic entry requirements. At GCSE, your A-level predictions, there's no advantage to being predicted 3 or 4 A stars over somebody that's predicted A star AA. We only look to see that you meet the minimum. So out of those 3,000 applications that we get approximately, we will have a few that don't meet our minimum entry requirements. They go no further in the process. For the ones that do, we then look at UCAT scores, which come to us in November. So we forget about your predictions now. We only look at your UCAT scores, and we rank students from top to bottom in terms of their UCAT total score. And the number is 2,700 because that's the total UCAT score that you can get. So that's why we talk about that score. Then when you come to interview, it's your interview performance that will get you an offer. So we no longer look at your UCAT scores, we no longer look at your predicted grades, we look at your interview performance. So at interview, you've got to demonstrate to us that you are an ideal candidate to come and study medicine at UCL, that you know what you're getting yourself into. What does it mean to be a doctor? What are the values and attributes and behaviours that are needed to study medicine and to be a doctor at the end of it? What preparation have you done that has helped you to understand those attributes and behaviours? And what do you know about the health service? What do you know about healthcare in general? What do you know about healthcare across the globe? What are the challenges in healthcare? So a lot of questions have been asking about what are the questions in the interview. I can't give you the questions in the interview, but what we ask you to do is to look at Medical Schools Council website. They've got an interview practice site with some practice questions. There's a practice MMI on there. That is a really good resource to help practice. And just as Charlotte said, record yourself. And then get somebody to look at it with you, play it back, as uncomfortable as it can feel. It helps develop your communication skills and to be able to articulate yourself to the interviewer. The interviewer wants to have a conversation with you. That's exactly what we want. Not a rote learned answer, not all of the buzzwords that are out there, but actual genuine understanding of your passion and motivation of your career ahead of you. So once we've done the interview, it's then the total interview score for each station is added up, and then we'll make offers to the top scoring interview attendees. We obviously can't make offers to everybody. We make enough offers that we know will convert into enough students to come onto the programme. So that's the process again. So I hope that that's clarified it for everybody. But if you have questions, have a look at our website. We've put it on our website. The selection procedure is there. Okay, so a couple of questions were about the challenges of London. So Lauren, having been through the 6 years, are there any particular challenges about being a medical student in London?
Yeah, so I think there are definitely quite a few challenges. I think one thing is that London is such a massive place. It can be very intimidating to move into London. There's so many people, which is one of London's strengths for sure, is that there's so many people from so many different walks of life. And it can be very overwhelming when you're just starting and you might not know anybody. It's also a very expensive city, as I discussed. But like I said, there's lots of opportunities for support with that. But yeah, I think that's why it's really nice, as Charlotte was saying, about the RUMS community and like how the medical school is kind of its own little family within the university. It makes it a lot easier to meet people, and it makes that a lot less intimidating. And yeah, I think London's a fantastic place. There's lots of opportunities and things to do. I think you have to consider whether it's the kind of place that you would like. I think some of my friends, for example, study at campus universities, which are a lot smaller. They know everybody in their university. For this 5-6 years, I'll be seeing the same people all the time, which is a bit more difficult in a city-based campus where the buildings can be more spread out, and you might not bump into the same. Well, you will within the medical school, but I think within the university generally, you might not see the same students all the time. So you've got to consider what's better for you. Some people like to be away from the city, like nature, all of that stuff, which is difficult when you're in the middle of central London. So you've got to consider your own preferences. For me, like I love staying busy, and I like art galleries and like music and stuff like that. So somewhere like London is great because I have all of that on my doorstep. But some of my friends, like surfing and like hiking and stuff, and for them being somewhere else is more suitable. So you've just really got to consider your own hobbies and interests, and where you can see yourself living for 6 years or 5 years, depending on where you go.
Brilliant. Thank you, Lauren. So we've got 10 minutes to go. So if you've got any last burning questions, please get them in and we'll try and answer them for you. So I'd like to come to Josh. There's questions about workload. So I wondered if you could answer 2 questions. 1, what are lectures like? And 2, how do you manage the workload?
Okay, so in first year and second year, the lectures are on Mondays, Tuesdays, and they normally have a break on Wednesdays. It changes in year 1 and 2, but then you have your clinical teaching, and then one final day of lectures. It can be a lot to adjust to when you first get to university, but you get used to it decently fast. And they do it in a way which, when you first start, they introduce the least content-heavy module first, so you can sort of get adjusted to it. But yeah, studying medicine is difficult, like everyone knows that. But I do think UCL does a good sort of introduces the workload well and gradually. And it's definitely possible to do a number of different things at the same time. As a personal example, I was a part of like quite a number of different societies, Muay Thai, martial arts societies, surgical society, medical society, part of RUNS too, and a number of social ones too. And you can maintain your social life at the same time. So yeah, it can be difficult, and you do need to have a good way of sort of managing your workload, and your organizational skills get a lot better. But it is definitely manageable, and it's not burnout inducing. Like if you approach it in the right way, like it doesn't just have to be medicine all the time.
Fabulous. Thank you very much. So in the last 8 minutes, we've got a question about what you most like about UCL. So I think again for Joel and Lauren, your reflections of what has been your favourite bit of being a UCL medical student. Should we come to you first, Joel?
Sure. Now, that is actually a very hard question because there's so many different experiences, I think. I don't know. I think my favorite part of UCL and coming here has just been the privilege of being able to be a medical student, to be really hands-on. Some of the things that you get to see as a medical student in London might be things that I never see again, unless I come back, or that you only really get to see a couple of times in your lifetime when you're working as a career. And I don't think that's something that you would find all across the country at all.
Brilliant. Thanks, Joel. And Lauren, do you want to answer that question as well?
Thanks, Joel's answered that very well. Yeah, I think I've really enjoyed, I guess specifically to UCL, I mean, that's my own experience, but it's just the community. And I think Charlotte spoke about this a lot, but I really wasn't expecting that to be such a big thing for me. I think it's amazing that now I have friends who have been doctors for many years. I have friends who have just started their medical course, all different ages, come from all different countries. And I think UCL offers the chance to try loads of different things. Like I'm in my last year, but this year I tried snorkeling society and like all this random stuff. And yeah, you've got central London on your doorstep. There's loads of things happening all the time. We've got access to some amazing hospitals. And as Joel said, you get to see things that are just such a huge privilege to be able to witness. And I think, yeah, being a medical student is just such a privilege. You get to be with people at some of the best and some of the worst moments of their lives. And I think, yeah, I wasn't expecting, I guess, to enjoy the entire degree as much as I have, and have met so many good people throughout it. And yeah, I think just UCL gives you a lot of opportunity to just be really rounded and kind of have fulfillment in all different areas of your life. The clinical work is really interesting, and then also all your extracurriculars can be very rich without compromising anything, which I think is just amazing. I've really enjoyed it.
Thank you. It's a brilliant course, and it's lovely to hear from our recent graduates that they've enjoyed all of it. It is a tough course. There's a lot to do. There have been many questions about the workload and how it differs to other courses. In the early years, there are more lectures and timetabled activities than perhaps other courses, but you have slightly less coursework to complete during the early years. So there is a balance. But the later years of the course, you are, of course, in the clinical workplace 9 to 5, Monday to Friday, except Wednesday afternoons. Wednesday afternoons are off for all London medical schools so that you can all take part in activities across the medical schools and universities. And so it is a lot more time. There's a bit more study outside of the programme as well. But all medical courses will be very, very similar across the UK in terms of the workload that there is. I'm afraid there's quite a lot to learn about the human body. There's a lot that goes right, and there's a lot that goes wrong. And there's a lot to know when you start work as a foundation doctor at the end of the 6 years. So we have 4 minutes left. Any last questions, please type them in the chat. I'm going to come to all my panelists now for the final question. One top tip for our aspiring applicants, please. Charlotte, do you want to go first?
I know it's easier said than done, but try not to compare yourself and your application journey to other people. Get off that student forum. You don't need to be seeing that this person got an interview and you haven't yet, or this person made the cut with this score. There's really no point. Admissions is a very complicated thing, and lots of things will come to you. There's no point worrying about something that hasn't happened to you yet. Especially just it's a stressful year. I think that year 13 year is probably one of the most difficult years that you've probably ever had. And it is tough, and you don't want to make it any harder by constantly comparing yourself and your journey, because it's completely different. I, for example, I got offers for medical schools literally a couple of days before the deadline, and I was for sure thought I was rejected. So things will come. Just don't worry about stuff that hasn't happened to you yet, and stay off the student forums. Don't compare yourself. I think that's my tip.
I love that tip. I think that's a really, really important point to make, actually, because it does feel very competitive going through the process of application and the application journey. Try and keep your head. Try not to be influenced by other people. The grass is always greener, isn't it, when you look on social media? Just follow your own path. That's important. Thank you. Josh, do you have a top tip?
Yeah, just to keep it quick, I would say just be as interested as possible in medicine, but don't do it for the sake of the interview. Just genuinely read and look at something that you find interesting, because there will always be talking points. And at the end of the day, the thing that they want to see is just interest in medicine and proactiveness to try and learn more. So yeah, don't do it for the interview points and stuff. Just you gain your knowledge is its own reward, right? You gain your own interest, and you get to read about interesting things. So just do it for yourself and stay curious.
Thank you, Josh. That's a really good point as well. Joel, next.
I think it really is just about being yourself, thinking through what you have done and really believing in that. And that's all that the interviewer, that's all that everyone at UCL wants to see, really, is can you think through a problem? Can you showcase what you're capable of? And you'll all be fine.
Brilliant. And Lauren?
Yeah, I think those have all been really important tips. I think I would just say be kind to yourself during the whole process. There's a lot of different components of the application cycle, and you'll have a lot of other things going on in your life. So I just think, spend time with your family and friends, still keep up your hobbies and stuff if you can. Just try to look after yourself during the process, because I think it's very easy to become very consumed by by your A levels or IB or the applications. But you know, there's more to life than all of this stuff, and you'll do better on all your applications if you're also just doing the things that you enjoy and looking after yourself.
Thank you very much. So that comes to the end of our webinar today. Thank you very much for joining us. It's been lovely to see so many people interested in studying medicine. We need doctors. We want you to apply. It's a fantastic career. So I'm sorry we weren't able to see you in person. I hope we might be able to see you in person in September if you sign up for our 5th of September open day. There are campus tours all summer arranged through UCL where you can meet students, you can see the campus and see what it's like. And this recording will be sent to you and will be available on YouTube and on our website as well for you to look back at. But if you have any further questions, please get in touch with the admissions team. We would be very, very happy to answer those for you. You often have lots of very specific questions about your own journey, and that's a lot easier to answer in an email to you. Thank you ever so much to all my panel, all of the students that have answered all of those questions in the background. I'm very grateful. Have a wonderful day. Keep cool, keep well hydrated. Bye-bye.